We know the Supreme Court will be taking up the Republican challenge to the Affordable Care Act just days after the election. And like you mentioned, there were critics that went after the law and saying that millions of Americans lost insurance because of it. Critics now saying millions of Americans could lose health care coverage if it is fully repealed. Is the president prepared to deal with the fallout of this if he's reelected?
Well, 100%. The case is going to be argued a week, I believe, from next Tuesday. So about 2 weeks away, it will be argued. The case won't be decided till probably the summer of 2021. So if it is called unconstitutional and if the entire law is struck down, then there will be a plan that is ready. We will ensure that everyone that has coverage will not lose coverage, unlike Barack Obama and Joe Biden in the last round of Obamacare. But in the meantime, this president has actually improved Obamacare, and that's one of the untold stories of this administration, too. After increasing premiums 35% in the exchanges under Barack Obama and Joe Biden, they've come down 8% under Donald Trump. The choices have expanded significantly. But let me tell you this, having said all of that, if you are a couple living in Hannibal, Missouri, you are 60 years old, and together you make $70,000, if you have a pre-existing condition and you want to go into the Obamacare exchanges, your premium is $37,000 a year, more than half of your take-home pay, and your deductible is $12,000 a year. That's not covering pre-existing conditions. And again, the Democrats again, exaltation is the best word I can come up with, of Obamacare and how amazing it's been and how all these people are getting all this amazing coverage couldn't be further from the truth.
Finally, I want to talk about coronavirus. We've seen some recent reports saying the president's been privately embracing the herd immunity strategy as a way to fight the virus. Is the president, in fact, pushing for this herd immunity approach? And if not, is the White House planning to change its approach at all to tackling COVID in a second term?
So obviously, COVID is a huge issue for this country. This president is not embracing the herd immunity approach, unlike what many are saying. He is absolutely confident in our ability to beat this virus, and that we have mortality rates down 85% since April. The death rate's down 85%. Even today, with the surges, hospitalization, only about 6% of the beds in the hospitals, other than 1 or 2 hotspots, 6% of the beds are used for COVID patients. We have put 100 million PPE out into the country, rapid tests into our most vulnerable communities, like our tribal communities, our HBCUs, our nursing homes, and our assisted living facilities. We are fighting this virus on every front. The vaccine is literally right around the corner. By the end of the year, we should have 100 million doses of free vaccine, again, for our most vulnerable, those in our senior citizen centers and in our nursing homes and other communities. So we are fighting the virus head on. The president has encouraged the wearing of masks, social distancing, ensuring that we keep safe. But having said all that, we cannot shut the economy down. 99% of Americans survive COVID under the age of 70, and the age over 70 is about 95%. So this is a virus. We can deal with it. Let's keep our vulnerable populations safe, but let's open our churches, open our schools, open our economy. The red states that have tended to open more quickly than the blue states have a much lower unemployment rate than the blue states. That getting people back to work is really, really important as this great economy continues to improve.
All right, Acting Director of Domestic Policy, Brooke Rollins, thanks so much for joining us and speaking about what's next in a potential second term for the Trump administration. We appreciate your time.
Want to see more videos like this? Visit OANN.com for immediate access to all the clips you've been waiting to see.